Let's talk about my work a little bit. So, what do I do? I am studying my MSc in counseling psychology, and this is my final year. Couple of months left to finish the degree, and I'll be finally practicing. So, my trainee practice has been started. I am taking up cases. I am seeing a lot of people with different mental health issues and concerns. So basically, what I do is therapy, provide therapy, different therapeutic modalities, approaches, and techniques. So today, I wanted to talk about therapy and essentially how our psychotherapy, is important in a very awareness point of view because I feel India lacks it even still now. And when I say that with a very confident uh, voice, that's because just a day back I was talking with one of my friend, and he is not from my fraternity. He's not a psychologist, he's rather a software engineer. And when I was talking with one of my friend who is not from my fraternity, and he's very well doing in his whatever field he is, he's a very hardworking person, a very sorted person. But when I was talking to him, i I just kind of given him a suggestion that why don't you try therapy. Not that he had a concern or something like that, but in general I said that why don't you go and try. Like, it is not always that you end up or land up in a therapy room, or you go and seek a mental health professional um, for any critical or crisis life situations. You can also go for therapy for self growth and exploration. And that's how we have been normalizing it, and we should normalize it because I think somewhere therapy is a lifestyle choice. And I feel that therapy is for everybody, not for any particular set of people or population. It is for all population, it is for everybody, it is for all the demographics, whether it's um, different age groups, different gender, different socioeconomic uh, statuses. I know that there are really challenges in lower socioeconomic statuses because they, one thing is affordability and availability and accessibility of the resources uh, in India. That is a challenge, but there are NGOs who are bridging this gap, who are trying to help. There are voluntary therapists who are working, but still there are a lot more people we do need in our field to bridge this gap. It's still going on, it's in the process. But that doesn't mean we won't seek up help, because there are help. There are helplines available for suicide prevention, there are helplines available for different other, safety concerns, I guess. So I believe that um, when I was having a conversation like such, that why don't you try therapy? So the first reaction came is मैं पागल नहीं हूँ, मुझे कोई ऐसा help की ज़रूरत नहीं है. And I am bringing this concern, and I'm bringing this kind of quote unquote statement to all of you because he is not the only one who thinks like this. All of us thinks like this. For most of the people, even if whatever profession you're in, you're highly educated, you're not educated, you're literate, illiterate, you do whatever you do, from which society you come from, whether you're a super rich person, whether you're a poor person, this is the notion, this is the awareness we still hold in today's era, that therapy is supposed to be for mental health issues, for mental health problems, for mental health disorders, but it's not so. And with this, I would like to pose a question over here. Do you think all your like to everybody, whoever is watching my video, to all of you, I would like to ask a question or pose a question over here. Do you think that your mental health is all fine? Question mark. And I know the answer. So just reflect back, take a pause for maybe 1 minute or 2 minute and think about it. सोचिए कि आपकी मेंटल हेल्थ ठीक है कि नहीं. और मेंटल हेल्थ ठीक होने का जो एस्पेक्ट है कि हम कैसे अपने मेंटल हेल्थ को इम्प्रूव कर सके, या मेंटल हेल्थ क्या है, what it is all about. Is it only about the disorders? Is it only about um, मैं पागल नहीं हूँ या मैं पागल हूँ? Is it only about this? Or is it much deeper? Or is it as simple as I'm not able to get up in the morning? I don't feel like going to work. I don't feel productive enough. I don't have interest in my hobbies. As simple as hobbies. I don't like to cook for myself. I'm feeling too lazy. ये सारे lifestyle issues है. And also as simple as I'm eating too much, I'm eating too less. Or as simple as I'm overthinking on something. It can be anything. Or as simple as I have a lot of shame and guilt. Or as difficult as seeing myself in the mirror every day because there is so much of burden I have. Because there is so much to hold on to and I don't know how to like express it out there. Be it whatever gender you are. You can be a man, you can be a woman, that doesn't matter. You can be anyone. You can be a queer, you can be anybody. Or as grave concerns as I have faced this very traumatic childhood, like childhood incident or experience, and I don't know whom to share it. I have never shared it with anybody. I have not even spoken up to my own family. So is there somebody who can listen to me, or who can genuinely listen to me, and who can not give advices or suggestions to me, because the world is already there to give advices and suggestions which doesn't fit me, but just listen. Throughout whatever I'm venting out is somebody there who can create a safe space, name as therapy, and can listen to my problems, my concerns, be it as simple as a sleep hygiene issue or as grave as an abuse, which I have not spoken to anybody. And that space should be safe, ethically, morally. That space should not provide any suggestions or advice to me. The space should also ensure I'm not getting stigmatized, judged, because the world is there to criticize me. Even I am criticizing myself, self criticism. We often do, all of us. I'm not good enough, I'm looking too fat, I'm looking too thin, I'm looking this, I'm looking that, I'm not good enough in this, I'm not confident, low self-esteem issues. So these are all, different constructs. We human beings are designed in two ways. We are social being, we are emotional beings. So for all of us, therapy is a space which is safe enough, and it is more exploratory because we kind of understand ourselves much better. And if we try out therapy and we explore ourselves in that particular zone with a very credible psychologist, psychotherapist, or counseling psychologist, or a clinical psychologist, based on your concerns, based on your approach, whatever you have, whatever your goals are, You can, or even if you're clueless, you don't know where to seek the goal from or which direction you're going to go. There's no goal. Some of my clients say, I don't have a goal, but they end up figuring out 10 goals maybe after the end of the session. But yeah, like, even if you have no direction to go, but you want to start somewhere, and you need to have a space where you can start somewhere without being stigmatized, because the society is already doing a lot of harm, and the society is already there to criticize you, it's already there to pose your judgment. So therapy is a space where you explore yourself, achieve your higher level goals, or as basic as simple goals in your life. It's not just for people who are having a deficit or a disorder. It is definitely for them because they're a very specific population, and that specificity also goes in with our specializations. Definitely, we do take up cases, severity, definitely. We do take up cases which are severe, but we also provide therapy in a very base level lifestyle issues where these simple things like waking up, sleeping, productivity, doing things, even exploring ourselves, even the way we think certain things, we feel certain things, we act out and behave in a certain way, we do need a space where we can explore all these things. These are very basic things in a daily day to day life, conflicts, and the way we go about it. And there's nobody to talk, there's nobody to hear, there's nobody to see. Because I have also seen couples, I have also seen in my previous internships where I've worked different hospitals, I have also seen couples over there. Just an example: what if you have a very bad day and you come with a lot of resentment and a lot of stress, simple stress, work life stress, or anything, or a burnout, or a fatigue, physical fatigue, and you come home and your partner, you are in a relationship, be it your boyfriend or your girlfriend, and or you're married with, be it your wife or your husband, whoever it is, you come up home and you just say that I want you to listen because this is how my day went, and they just come up and say, because most of the people usually end up doing this because they also have their own baggages. So what you expect them to listen, and they come up and say you that I'm not your therapist, go and check with somebody, or I'm not, or even not give that space to even listen, they just ignore you. They just, okay, I'll get back to you, or something like that, oh, this is not important. They just don't validate. Majority of the times our own people lack that validation because they also have their own baggages. They're also not pouring it out anywhere, they're also suppressing it. So there's a lot under the carpet, there's a lot, brushed under the carpet, and we usually hide the carpet. So it's like that. And we also feel shame and guilt and fear to open the carpet and clean it off. So I always say that cleaning our mental house is very important. So therapy is another space to provide that, how you clean your whole mental house. So it is not just कि कोई specific disorder को लेके focused है, definitely है, but it is for all of us. And even I take up therapy, I go for my own personal counseling sessions. I have a therapist who's much more senior, she's also practicing. You can now call me that she's my mentor as well, because I kind of take guidance from her, even on the career, in my career, because she knows that I am pursuing. So, and all my friends, all my batch people, or all my colleagues whom I'm working with, and everybody out there, even our professors, they have also been into therapy and they still go to therapy. There are uh, professionals also who is working in our field. We are actively into therapy, so we take up sessions whenever we can, and we are actually doing it because whatever we are receiving, we also need to channelize that. We also need to vent out things, process things, and for a higher growth. So when I started my therapy journey, it was more focused on my problems. Now it is more focused on the solutions, and now it is more higher level, because now I am at a, proper functionality. So my functionality has no issues. I don't have any issues with my daily life functioning. But now I am aiming for my higher order goals. So self actualization, I'm going into spirituality, I'm going into things where it is more higher order achievements in my life, because I've already set a base throughout. Like maybe I'm taking therapy since when I was 12 years of age. So I started my therapy journey when I was 12 years of age. And I'm normalizing it. I'm normalizing for everybody that it is no wrong to take up therapy sessions. Everybody should take, and my whole entire family has went through therapy. My parents have also joined my sessions and had a family session. So that's how wonderful. I am blessed and supported by a family environment where they are supporting therapy. They have inculcated therapy in our lifestyle choices. So I think I'm blessed in that way. So it's like that. So I feel that therapy should be normalized, and it is not something to do with only pagal log, या only mental health affected disordered people. It is for every one of us. So I started referring to my friend whom I was discussing with and his point of view. And then I kind of tried to explain him that why therapy is important the way I explained here right now. And then I think it's again his choice whether he's going to pursue it or not, because it's an autonomy for everybody. We cannot force somebody to a therapy, so, or to seek therapy. But it's always a freedom and choice for a person to go and uh, seek help. And also it's something very personal and individualistic. So if I feel that I need self growth and I want to explore it with a person whom I can go and build up that rapport with, and I can explore, fair enough, I'm just trying it. And definitely, some people would say that therapy is too costly. Um, but I think, to the matter of fact, everything is out there has some cost to it. You are paying uh, for buying even your clothes. You're paying for eating your food. You're as basic as that. Like eating food is also as basic as that. So if that is also having a cost, the basic needs, then therapy itself is a professional help. We are not giving it. It's not something. It's a professional alliance. It is a professional help. We are not. Definitely, there are reimbursements. There are organizations who has even voluntary services, and who has even different other ways of providing therapy services, or different other counseling services, or broadly the mental health services. But I think जो लोग मुझे कुछ लोग ये भी बोलते हैं कि therapy is too costly, so I'm not gonna end up there. So do you think that, even if I do agree with the fact that ठीक है, it is costly for people might not afford, because सबकी financial conditions same नहीं होते, but कुछ लोगों की financial conditions अच्छे होने के बाद भी they don't like to choose it, because um, एक तो पर्सनल चॉइस आ जाता है कि वेदर आई वांट टू ग्रो और नॉट इन माय लाइफ. एंड सेकंड थिंग इज, because it's money comes into picture, so people are like avoiding it, and already a stigma is there for mental health. So that is kind of creating a bias in everybody's mind. So I believe that um, even if you decide to go on a therapy, or you don't decide to go, that is your personal choice. But do you really think that sitting with your problems, or sometimes you're just so unaware of your problems, where this other person is objectively observing you, understanding you without any judgment, and not giving you suggestions or advice, but rather they are trying to help you to figure out your goals, to bring the strengths of yours, to improve your weaknesses, and make you achieve those goals. And it is also something which you might not continue after a while, or you can again come back and continue. It is flexible, and this approach can help you to learn in life. The basic unit of, I think, life experiences is learning. So I think it's a very positive way to reinforce your learning, I feel. So, and then again, it's for the individual whether they want to take it or not at the end of the day. But therapy is for all, I would say. Therapy is for everybody, because it starts with self and it goes back to the world, each and every person around, because we are social beings and we are emotional beings. And I think world is already going so crazy. there's a lot there's a lot to process, to learn, and to relearn and unlearn, and function in a way where we can feel safe, happy, nurtured, fulfilled, satisfied. And if we see life as a whole, our experiences matter, our emotions matter, both negative and positive. I'm not going to only talk about the positive part of the psychology, I'm also very open to understand the negative part and the pain and the grief and the stigma around it, because it is hard when there's no one to hear you out, no one to see you out, no one to feel you. But therapy is a space where you can feel that. I personally has felt, I used to think about myself when I was a teenager that I'm good for nothing. But I figured out that I'm helping people out there. From healing myself to becoming a healer, this journey has taught me a lot about myself. And I'm so proud about it, that I have been one of those individuals who are very sorted with my mind, with my clarity of decision making to go about things and to make things. And I'm still learning. It's not that I have learned it completely, because I feel there's no end to my learning, and I want to explore it further, and I want to still learn, and I still want to go and end up into therapy sessions, into mentoring sessions, getting trained, getting supervised, and then help it with the coming generation and people out there whom I'm working with. So yeah, it's like that. Whatever I learned, I give back to the society. That's how it is. So I feel that therapy is for all of us. I am also included in that, being a counseling psychologist. That's all. Thank you. Good luck. Heart it out with Sai Baba.